Alright, I'm Thomas Sims, and this is my basic proficiency assessment video. Hi, I'm Thomas Sims. I'm a Research College of Nursing nurse practitioner student. Is it okay if I do an assessment of you today?
Yes.
Alright, I'm going to start by doing hand hygiene and washing my hands. Wash, wash, wash. Alright, can I have a name and birthday on you?
Charlene Sims, August 15th, 1995.
Okay, and tell me the date and where you're at.
August 31st, 2017, and I'm at my house.
Perfect. She's alert and oriented ×4, no confusion noted. Okay, I'm noticing her dress. She's wearing a tank top and shorts, which is appropriate because it's pretty warm outside. Her mood seems excited, happy to be doing this with me. Thumbs up. All right, I'll take it. I'm going to notice her skin on all four extremities, pink and warm to touch, which is normal finding. Okay, I'm going to inspect your head. I'm going to palpate your head, your scalp. You let me know if you feel any tenderness or anything like that, okay? Alright, I'm looking. Looks good, clean, thick, none's coming out. Scalp is pink. No nits, no lice. Good and clean hair. Any tenderness when I touch it? Perfect. Okay. Alright, so I picked out one abrasion on her wrist, medial wrist here. It's about 1 centimeter, well approximated, pink, no drainage, and no odor. Okay, so I'm going to start by looking at her face. Eyebrows and eyelashes both look full, no hair loss, equal, symmetrical on both sides. I'm going to look at her conjunctivas. That is pink, no redness. Mucous membranes are moist. I see no drainage or no foul odors coming out of that, which is a normal finding. Looking at her sclera, it is white, not reddened. Her her pupils are about 3 to 4, probably say 4 millimeters. Now we're going to check your eyes, and do the field by confrontation. So I'm going to come out wide with my hands like this. You tell me when you can see my hands moving, okay?
Here.
Right there?
Mm-hmm.
Okay. Do the same thing up and down.
Here.
Right there?
Mm-hmm.
Okay. So now just with your eyes, keep your head still. Just follow my finger, okay? This is the 6 cardinal gazes. You go left and right, and then the 4 diagonals. Do not need to go up and down on this assessment. Okay. Perfect. Now follow it in. Okay. One more time. I noted no nystagmus. Her eyes were able to follow the finger. Okay, so from her outer canthus of her eye, it goes up to her top of the auricle here, which is a normal finding. When I palpate it, is there any pain and tenderness? No. I see no drainage, no foreign bodies on that one. You'd see an earring. Same on this side. Any tenderness?
No.
No foreign body, no redness, and no drainage. Okay, I'm going to look at your nose. Tip of it, dorsal, all of that. Any tenderness when I palpate it?
No.
Alright, I'm going to have you look up. Look in your nose. Looks nice and moist. No problems there. I'm going to look in your eyes. Just look forward. Okay. Look forward. Okay. They started about 4 millimeters, and they are both equal and reactive to light bilaterally. Can I have you push on one side? Okay, do the other side. Pain, no congestion or no production there. Okay, smile. Okay, you can feel when I touch your face.
Mm-hmm.
You have sensations throughout. Okay, smile was symmetrical. Face is symmetrical. Okay, I'm going to palpate your lymph nodes now. I just want you to tell me if they're tender at all, okay?
Okay.
Okay. Preauricular, postauricular, tonsillar, submandibular, submental, superficial cervical, deep cervical, posterior cervical, and occipital.
Mm-hmm.
Then we'll do the infraclavicular and subclavicular. Sub is on the top. Supraclavicular is on the top. And infraclavicular is on the bottom.
No tenderness.
No tenderness? Perfect. Okay, was not able to palpate any. I did not feel any masses. None were fixed or none were mobile, which is also a normal finding. Okay, I'm going to come down. I'm going to look at trachea. Any tenderness there?
No.
Okay, it is midline, which is a normal finding. Check your TMJ joint. Okay, I'll have you clench down really tight. Open. Open one more time. I do note mild crepitus on especially the right or left side of her TMJ. Alright, I'll have you turn one way, turn the other way. Okay, then I'll have you push against my hand to check for sternocleidomastoid resistance. Any tenderness or any difficulty doing that?
No.
Okay, have you do a shoulder shrug. Feel okay?
Mm-hmm.
Alright, have you do one more shoulder shrug. Is that okay with a little resistance?
Yes.
Perfect. That is a normal finding. Normal assessment finding. So I'm going to move on to your thorax. First, I'm going to just inspect it. Inspect the depth of her breathing. Do it posteriorly, anteriorly, all of it. She has no increased work of breathing right now. Her breaths are not deep or shallow. They are regular. Her rate is about 16 a minute. Normal for an adult is 12 to 20. I'm going to listen to your lungs, so when I say it, just take a deep breath for me, please. Deep breath. Deep breath. Deep breath. Listen laterally. Deep breath. Listen posteriorly. One more. And making sure to listen under her bra here. One more deep breath for me. Okay. Lungs were clear to auscultation bilaterally. No adventitious sounds. So I'm gonna palpate. You tell me if you feel any tenderness. I'm gonna be looking for masses here. Okay.
Okay.
Any tenderness there?
No.
Okay, I'm gonna come down. Feel laterally. Any tenderness there?
No.
Perfect. And no masses. All right, we're gonna do something called tactile fremitus. I'm gonna put my hands on you, and you say 99 as I go down your back. Okay.
Okay.
This checks for consolidation.
99, 99, 99, 99.
Okay. Let's do it anteriorly now.
99, 99, 99,
One more.
99.
Okay. Perfect. This one. We're still going. That went black, so it turned off. Okay, so now I am going to listen to your heart. I did not notice any barrel chest also. It was symmetrical on both sides. I'm going to listen to your heart rate for 1 minute.
Okay.
And your stopwatch turned off. Use her. I'll show it to them so they know we're cheating. Phone is just a stopwatch. Okay. Alright, that was at the point of maximum impulse, and I got a rate of 71 beats per minute. So now I'm going to auscultate her heart. I'm going to do it with both the bell and the diaphragm of my stethoscope at all 5 points. It'll be aortic. I'll show you. Aortic. Pulmonic. Herbs. Tricuspid. And mitral. Okay, I'm going to do the same thing with the bell of my stethoscope. Alright, I was able to hear S1 and S2. Did not hear any murmurs or gallops, which is a normal finding. I'll have you lay back now, and we will do an abdomen assessment. Alright, I will start by just inspecting her abdomen. Okay, it looks flat, it's not distended, non-firm. Umbilicus is midline, no vascularity noted, so I'm going to listen to your bowel sounds. You would listen to each bowel sound for a complete 1 minute. For time's sake, we will listen not for a minute. We'll start with the right lower, left upper, and then right upper quadrants. Okay, and then for time constraints, if you had more time, you would listen to each quadrant for a full 1 minute. I was able to hear normal active bowel sounds in all 4 quadrants, which is a normal expected finding. So now I'm going to palpate your abdomen. You just tell me if it's tender in any areas, okay? I'll start by doing it light, all 4 quadrants again. Okay, and go a little deeper. That feel okay?
Yeah.
I don't feel any masses, soft, non-distended, all normal findings. So I'm going to palpate your liver now, okay? Right under the ribs, kind of hook down in there, take a deep breath. Alright, unable to palpate the liver, I'm going to do the spleen. That is, the liver's on the right side, spleen will be on the left. Okay, I'm going to do your kidneys. Come back. Is that tender at all when I do that?
No.
And I'm unable to palpate the kidneys, which is also a normal finding. So now we will do a percussion. Okay, expected finding is resonance on this. All 4 quadrants again. Using the middle finger. Okay, that sounded resonant. So I'll have you sit up. And I'm going to do the same thing to your chest again, okay?
Okay.
I'm going to do it anteriorly and posteriorly. On bone, it is flat, and on organs, it is dull. On back here, I'm going to check your cussovertebral angle. You just let me know if there's any tenderness, okay? Put my hand, and then I'm going to hit against my hand. Both sides. Any tenderness noted there?
No.
Okay. So moving right along, we're gonna check your strength and range of motion of all your joints. Okay.
Okay.
All right. So I'm gonna have you supinate your hands, pronate your hands. Okay. Can you do thumb to finger? Okay. Perfect. Up, down. Abduct, adduct. Okay. Do the abduct and adduct one more time. Okay. I note no crepitus, fluid, easy flowing range of motion, no pain or anything with that, right?
No.
Okay, so I would do the same thing with a little resistance, okay? Up, down, okay. Up, down, okay. And come out, abduct, adduct. Perfect. Abduct, adduct. Okay. I notice bilateral strength is equal and strong. So I'm going to check your pulses now. Okay, I'm going to start with carotid. Okay. 2+ on both sides. Radial. 2+ on both sides. Brachial. Okay, 2+. 2+. Femoral would be here, but she's going to defer that one. Popliteal. It's more on the medial aspect of the knee. Able to palpate that one, 2+. Okay, 2+ on that. Post-tibialar. Okay, 2+ bilaterally, and then lastly we'll do pedal pulses. While I'm down here, I'm going to look for any clubbing of the toenails, any clubbing on the fingernails. I'm going to do cap refill on all 4 extremities, which is about 2 seconds on the lower extremities. I'm checking skin turgor. There's none noted. It goes down immediately. Cap refill on all 4 extremities is about 2 seconds, which is a normal finding. Under 3 seconds would be the normal finding on that. Muscle tone is normal. I don't see one side bigger than the other. Both are symmetrical. She shaved her legs recently. No hair on the legs. All 4 extremities are warm and equal. Okay, we're going to do your reflexes now. So I'm going to grab my stethoscope again. Okay, we're going to start with biceps. So I want you to supinate your hand and relax your arm. Okay. This suspected finding is a little twitch in the muscle here. There's a little one right there. Do it on this side. Same thing, supinate your hand. Okay. We'll do the tricep reflex. Have her elbow at a 90-degree angle. Have you completely relax your arm, okay? Suspected finding will be a twitch in the triceps muscle on this one. Okay. It's a little one. You're going to do that on this side also. Thank you. There we go. Okay. Okay. We will do the your knee reflex under your patella bone. Can you scoot back and try to hang them as good as you can? I'll kind of try to support it a little bit. The expected would be just a little thing like that. Might be hard in this position, but I did see a little reflex there. Okay, do it on this side. There's reflex right there, which is normal. I'm going to have you supinate your hand one more time. I'm going to shake your reflex here. I'm going to hit right above your radial pulse. With your hand supinated, just a small curl of the hand is expected. Okay. Brachioradialis. Okay. So I'm gonna have you actually can you lay on your stomach and I'm gonna check your Achilles.
My stomach.
Yes. Check your Achilles reflex here. Okay, have her relax her feet, and you're gonna hit right back on the tendon on top of the, right here, right above the heel. Expected on this is their foot is gonna go, it's gonna um, extend up a little flexion, not dorsiflexion. Okay, and now I'm gonna have you roll over back onto your back. And I'm gonna have draw S. She's very ticklish, so that might explicit more than just a reflex. And the expected is a little toe curl. Okay, we're gonna skip that one for the video's sakes. Alright, so stay on your back. I'm gonna check for clonus now. Gonna just hold her foot up for a while. And expected is if it goes straight back down, dorsiflex, without relax your foot. And when I let go, just relax. Okay. Goes right back down. Alright, goes right back down. So unexpected would be if it goes like that, could some kind of neurovascular injury. Alright, so I will have you close your eyes now. And I'll have you, I'm going to do a dull or sharp sensation, and you tell me if it's sharp or dull, okay? And you tell me where it is for proprioception, okay?
The hole on my right foot.
Okay.
The hole on my left foot.
Do that one more time.
Sharp left foot.
Yes. Alright, I'm going to do it on your stomach now.
The hole on the left.
Yep.
Sharp on the left. This is dull on the right.
Yes, dull on the right, sharp on the left. Alright, sit up and we'll do your upper extremities now.
Sharp on the right.
Okay.
Dull on the left.
Okay. Perfect. Okay, so I'll have you open your hands up. Supinately, please. I'm going to put an item into your hands and you will tell me the shape of that. This is going to... Okay?
Okay. Circle.
Okay?
Circle.
Okay. And I'm going to draw a shape into your hands and you can tell me what that shape is, okay?
S. Triangle. An
It was an A. Perfect. Okay, I'm gonna just think through and see if there's anything I missed. And I think that is it. That's gonna wrap up my assessment. All right. Thank you.